My name is Rodd Stein. I'm a pediatrician located in Northern Westchester, New York, and my office is in Yorktown Heights. I produce this webinar so that you and many of our parents can learn more about immunizations and why it is so important for your child to be fully vaccinated. If this interests you, please listen or read on. First, I think we should talk about what vaccines are, why we need them, and what impact they've had on the health and well-being of our children. Historically, the first vaccination to be invented was the smallpox vaccination. Inoculation, which is slightly different, was first attempted in the 18th century by extracting fluid from people who were infected with smallpox and injecting it into people who were not. It was a risky procedure, but the fatality rate of 2% was much less than it would have been if you naturally contracted the disease. Vaccination was first invented by Edward Jenner in 1798 when he found that after doing a similar procedure using cowpox, people became immune to smallpox. Cowpox was far less severe, and the risks from vaccination were much less than from inoculation, and exceedingly less than if you contracted the disease naturally. Due to a massive global effort, smallpox was declared eradicated from the world in 1980, and vaccination was stopped. Other vaccines soon followed. Diphtheria in 1888, cholera and typhoid in 1896, the plague in 1897, pertussis in 1915, and the tuberculosis vaccine that is still in use today was in 1927. The yellow fever vaccine came out in 1935. For the rest of this webinar, I will try and focus on the vaccines we use most commonly these days in the United States. So let's first talk about influenza. In 1942, 24 years after the Spanish flu killed almost 50 million people worldwide, the influenza vaccine first became available. The strains of the flu vaccine affecting us change almost annually, and what the CDC and other organizations do is they look at the southern hemisphere, such as Australia and the southern Pacific Islands, during their winter and try to determine what strains to incorporate into a vaccine, hoping that those strains will migrate north and affect us during our winter, and that the vaccine will correlate and protect us against those strains. So it's a new vaccine almost every year, and that's done to adapt to the changing strains of the flu itself. Yet even with a good vaccine, almost 36,000 people in the United States die from the flu each year, and this is often the very young and the very old. Polio vaccine was first developed in 1955 by Jonas Salk. It is a very contagious virus affecting the central nervous system and often causing permanent paralysis. Before the vaccine, there were several epidemics in the United States, peaking in 1952, where there were 58,000 cases. In 6 years after the vaccine was introduced, there were only 161 cases. The next vaccine is measles, mumps, and rubella. Each component of the MMR was invented separately starting in 1963, but the entire vaccine came together in 1971. Measles is a highly contagious disease, the symptoms of which are typically fever up to 104 to 105, runny nose, red eyes, and a full body rash. Since the vaccine came out in 1967, there has been more than a 99% reduction in the cases of measles in the United States. About 30% of people who contract measles will get a complication, such as pneumonia, diarrhea, encephalitis, and blindness. 1 in 3 people out of 1,000 will die acutely of the disease. Mumps is another highly contagious disease, the symptoms of which are high fever, fatigue, muscle aches, and a headache, along with painful swelling of the parotid glands. Complications of the illness include meningitis, pancreatitis, and rarely infertility. Since the vaccine came out in 1967, there has been more than a 99% reduction in the cases of mumps in the United States. Rubella, the third component of the vaccine, or German measles, tends to cause a shorter, less severe illness than the measles described above. The symptoms are similar in that affected persons will get a fever, fatigue, swollen glands, and a rash, but does not cause the same complications as that of the measles virus. The main complication of rubella is something known as CRS, or congenital rubella syndrome, and it can occur in up to 90% of infected women, especially if they contract the illness in their first trimester. It can lead to heart defects, mental retardation, autistic spectrum disorders, blindness, deafness, and miscarriages. The next vaccine I want to talk about is the meningitis vaccine. And anyone attending college and filling out pre-college physical forms will be familiar with the request for meningitis vaccine status, which now seems to be required by most of the colleges in the United States. Initially, a person will complain of fever, headache, chills, neck stiffness, and a purplish rash that may spread to cover their entire body. The bacteria which causes the disease can be devastating within hours of the development of symptoms and can lead to death in up to 20% of the people. Of the people who recover, up to 20% are left with permanent disability, such as brain damage or the loss of limbs. Another form of meningitis that affects younger children is Hib, or Haemophillus influenza type B. Although this illness seems to be the least talked about when it comes to vaccination, it is one of the scariest of the vaccine-preventable illnesses. Prior to the widespread use of the vaccine in the early 1990s, approximately 20,000 children, most of them under 5 years of age, got invasive Hib infections, and 1,000 of them died. Since the licensure of this vaccine, there's been a dramatic decrease in the incidence of Hib. As you can see in the chart, it's almost 99%. Okay, the hepatitis B vaccine. Hepatitis B virus is acquired through the contact with contaminated body fluids, such as blood and saliva. The younger you come in contact with the illness, the more chance you have of developing lifelong or chronic hepatitis B infection, which can cause liver failure and liver cancer. Protecting infants with hepatitis B vaccine is the best way to prevent the acquisition of the disease and can ultimately save their life. This is why it is so important to give the vaccine to newborns. Since the introduction of the hepatitis B vaccine, hepatitis B has declined 82% since 1991. Hepatitis A is similar to hepatitis B in that it causes liver disease where you may turn yellow, have loss of appetite, nausea, and fatigue. It is different in that it is not chronic, spread through contaminated foods, not bodily fluids. It is not very common in the United States, but your risk increases when you travel outside the US, especially to Central America and Africa. We are giving the vaccine in an attempt to eradicate the virus, and since it became available in 1995, the rates of hepatitis A in the United States have fallen to the lowest levels ever recorded, as you can see in the chart. Okay, so chickenpox. Before the chickenpox vaccine became routinely used in the United States, there were approximately 100 deaths and 11,000 hospitalizations every year. Thanks to the vaccine, hospitalization rates have fallen 84% and deaths have fallen over 90%. In addition, getting the vaccine can prevent future episodes of shingles, which is a reactivation of a latent chickenpox infection. The next vaccine that I want to talk about is streptococcal pneumonia. Before we started using it routinely, strep pneumonia was a major cause of meningitis, sepsis, ear infections, osteomyelitis, endocarditis, and sinusitis. Before the vaccine, there were approximately 17,000 cases of invasive pneumococcal disease, including 700 cases of meningitis every year. Since the vaccine has come out, there has been a dramatic, over 90% reduction in pneumococcal disease in children, and over a 98% reduction in the diseases caused by the strains that are included in the vaccine. Rotavirus. Rotavirus is the most common cause of severe acute infectious diarrhea in the world, and it is responsible for the deaths of almost 500,000 children every year, mostly in developing countries. Since its use, there has been an almost 90% reduction in hospitalizations due to rotavirus in the US. The effect was dramatic in our practice, and we haven't seen a case really since the vaccine came out. So the next vaccine I want to talk about is the human papillomavirus vaccine. HPV is the only cause of cervical cancer, genital warts, and it is a major cause of throat and anal cancer. HPV is the most prevalent of all sexually transmitted diseases, and it is estimated that almost 90% of sexually active people will have encountered one of the strains of the virus in their lifetime. This is a very difficult to treat form of cancer in that it tends to have no symptoms until it has become more advanced. It is estimated that there will be about 13,000 new cases of cervical cancer and about 4,100 deaths in 2015 in the United States alone. So with all the benefits that we've shown that vaccines give us, why do people object to vaccines? Well, as long as there have been vaccines, there have been people and organizations who have been opposed to having them. This dates back all the way to Edward Jenner's time and the introduction of the smallpox vaccine. Some of those people, just as it is today, have been very popular and well known. Many are well educated and speak eloquently. Some were and even are doctors, and many are better spoken than your run of the mill pediatrician. Historically, even Ben Franklin was initially against inoculation, but later in his life became one of its staunchest advocates after his 4-year-old son died of smallpox. Almost 300 years later, we have seen the elimination of that disease, along with the near eradication of polio and the marked decline in measles, mumps, rubella, Hib meningitis, and diphtheria, all due to vaccinations. Yet instead of celebrating vaccinations as one of our greatest accomplishments, we are still meeting with opposition. So I thought I'd talk about why. The four major objections to vaccines seem to be religious objections, the side effects are worse than the disease, or, well, that's what people would say, infraction on civil liberties and the rights of the individual, and the fourth opposition seems to be that they do not work. Aside from some slight nuances, these objections have not changed much in the past 300 years. So let me address each one individually. Religious objections. The ironic thing is that there is no major religion that has an anti-vaccine policy. Many, if not all, religions have a love thy neighbor as you would love thyself clause, which kind of works well with the good of the community philosophy that supports something known as herd immunity. What that means is that some people in the community may not be able to be vaccinated for various reasons, such as immune deficiency or cancer, let's say, and vaccinating your children and yourself, protecting yourself against these diseases will have an effect of protecting them also, which means that you getting vaccinated protects the people in your community who would otherwise not be able to be vaccinated. So then there's a fear of the side effects of vaccinations. And some people argue that the side effects can be worse than the disease, or that getting natural immunity to the disease is better than getting the vaccines. And the truth is, vaccines do come with side effects, but most of the time it just means that you're going to have a sore arm or a sore leg. Occasionally you may have a fever or be irritable, but that's really about it. So then there's false belief that vaccines don't work. Anti-vaccine groups will point to charts. They'll show stats revealing how the incidence of this disease or that disease was decreasing even before vaccines against them were licensed. And the truth is there has always been seasonal variability to diseases, and in some years there is less of a particular disease than others. But diseases just don't decide to disappear. People will blame good sanitation or changing living conditions. But two recent examples of diseases that have just pretty much disappeared as a result of vaccination are the Hib and the chickenpox. They were widely used in the late 90s, and there has been no significant change in living conditions in the United States, yet we've seen an almost 99% decrease in the incidence of those illnesses. So what I advise patients and parents and other people I encounter to do when they are looking for information on vaccines is to check your sources carefully. When the information comes from the Center for Disease Control, the World Health Organization, the Academy of Pediatrics, or the Institute of Medicine, you can pretty much bet that it's accurate, well-researched, and peer-reviewed. And that's the kind of data you want to base your opinions on. So let's say some misconceptions. And I would say that during at least my time as a doctor, the biggest misconception is that vaccines cause autism, or at least are responsible for its increase. In order to understand how this came about, let's look at the history of the quote-unquote association. In 1998, a gastroenterologist in England named Andrew Wakefield came out with a study involving 12 children where he concluded that they had acquired autism from the MMR vaccine. The study caused an almost overnight drop in the rate of MMR vaccination around the world and an increase in the number of cases of measles, resulting in the deaths of several children. In 2004, a reporter for the London Times named Brian Deere uncovered that Dr. Wakefield was hired by attorneys who were suing vaccine manufacturers and was asked to come up with evidence implicating vaccines in their clients' illnesses. As it turns out, he faked the data, and in 2010, the General Medical Council in England found Dr. Wakefield guilty of serious professional misconduct and took away his license to practice medicine. Subsequent studies conducted on hundreds of thousands of children have not shown a link between the MMR vaccine and autism. The consequences of the anti-vaccine movement are beginning to show in resurgences of diseases like whooping cough and measles, which had previously been eliminated or controlled in the United States by vaccines. In 2014, the Center for Disease Control reported 668 measles cases occurring in the United States, which is a record high since the disease was declared eliminated from the country in 2000. So far in 2015, 189 cases have been documented after a large measles outbreak originating in Disneyland infected 125 people. The disease's subsequent spread to multiple United States fueled a national debate on whether the fear of vaccines was responsible or well-founded. So I hope this webinar was helpful. For a more in-depth review of vaccinations, please refer to an article I wrote on our website, pediatricswestchester.com.